Welcome everyone to today's session. Thank you for joining. Scalability of Community-Based Participatory Research, Older Adults and Technology. I am Miles Dietz Castell and I'll be your host today. I am the Communications Coordinator for NNLM Region 6. I'm based out of the Hardin Library of the Health Sciences at the University of Iowa.
Hi, everyone. Oh, okay, go ahead.
Yeah,
Sorry.
I got a couple more. Yeah, so before we begin, I just have a few kind of informational items for the presentation. Closed captioning is available by clicking on the icon with the three dots at the bottom of your screen and then selecting captions. Everybody has been muted to limit background noise, but we do welcome your comments and questions throughout the presentation. Because we have a large audience, we'll ask that you use the chat function for comments, and then if you have questions for the presenters, please use the Q&A function for those. We'll collect those throughout the presentation, and we'll save those for the end. As a reminder, by registering for this session, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. This webinar is eligible for one Medical Library Association CE, which you'll be able to claim through the evaluation link that we'll share at the end of the presentation. And speaking of the evaluation, your feedback truly matters to us. It helps us improve and build future trainings, so we do appreciate the feedback. If this is your first time joining one of our webinars, I'll give a quick snapshot of who we are. We are the network of the National Library of Medicine. Our mission is to make sure every health professional in the U.S. has equal access to biomedical information and to help the public find trustworthy health information so they can make informed decisions. And how do we do that? We run free trainings and webinars like this to support librarians, educators, and health professionals. We create guides and toolkits that you can use and share. We have funding and engagement opportunities that helps make a bigger impact. Today's session was organized by Region 6 as part of our Speaker Spotlight webinar series. This series features expert guest speakers presenting on topics of interests, which include librarians, public health practitioners, educators, clinicians, and others who work with health information. You can find upcoming webinars like this on our training calendar, nnlm.gov/training. And it is my great pleasure to pass it over to Anita and the team. And I'm going to turn my camera off and I'm going to let you guys take it away. Thank you.
Thank you, Miles, for this great info. And my name is Anita Saravan, and I am an assistant professor in the School of Nursing at Northern Illinois University. And it is indeed an honor to share with all of you what we did in the past year on working on this wonderful project that was funded. I would like to pass it on to Dr. Srikanth, who she was one of the STEL facilitators, to share about herself.
Hi, everyone. Thank you for being here. My name is Shalini. I'm a clinical assistant professor with Loyola University Chicago. It's been an absolute pleasure and an honor to be on this project, and soon we'll share more details.
Valanley and Hannah are the student digital champions, and they will share about their experience towards the end. Thank you for joining us again, all of you, and we will go ahead and start sharing about the project. So here we are. I'm going to start sharing the slides. Okay, we, the STEL team, Smart Tablet Education for Healthy Living Phase 2 project, team, are so delighted to share with you what we did in the past year with the older adults in our community. First, we want to acknowledge NNLM and Illinois State Advisory Group, SAG team members, and NIU for giving this opportunity for funding our project and having us take this leap into the phase 2, where we scaled our original STEL 1 project. The objectives of our funded project was to primarily improve digital health literacy in older adults. That was the overview of this project. And our outcome was to scale this project from the phase 1 to the phase 2. And we accomplished this by training facilitators. And along with the digital student champions, we were aiming to reach 30 to 40 older adults. For today, we will share with you how we identified the digital divide based on the literature and targeted to improve digital health literacy so we can improve access to care for our older adults. And then we will discuss briefly about our STEL phase 1, which helped us get to STEL phase 2. And then Dr. Srikanth will share about this implementation phase. And after that, we will hear from the student digital champions and other STEL facilitators who are also going to be here to answer some of your questions. So when you think about older adults, some of you might know this, we anticipate that by the year 2050, 22% of our US population would be older adults. Just take a minute and to think about it, right? 1 in 4 would be older adults by 2050. And when you think about this fast growing population, each of us in that age group, when we get there, will have at least 2 to 3 multiple chronic conditions. So multimorbidity is a huge issue. And more than that, at 65 and above, that's when we all consume the largest of the healthcare budget. So that's 66%. Almost, more than half, right? Like almost 3/4, but more than half. So let's think about it. Like if we have this huge growing population that needs to use healthcare and we want to really help them, how can we do it without digital health literacy? Because as we know, for everything we take our phone, right? Like think about it. When we go into our older adults population, how many of them are able to successfully use an app like MyChart or a health app? Think about their fingers and their vision, and are they able to touch and, cognitively, are they able to do this? So that's where this starts. So studies show that older adults have low levels of DHL, which I'm going to call DHL going forward, than younger populations. So studies show that when we have higher DHL, particularly in older adults, they report that they can self-manage and engage in their own medical decisions. So maybe looking at their apps for medications or getting an appointment or using MyChart, communicating with their nurse or the physicians, and self-manage is a huge thing, as we know, right, in this day and age. Then they are able to get greater ability to follow preventive health measures, maybe looking at their steps or looking at their sleep. And then if we have higher DHL, we all experience higher quality of life, of course, right? And then the sense of purpose and the sense of optimism is higher. So based on these studies, if we think about it, in the older adult population, social isolation is a huge thing. We can all relate as to how when we get older or when we see our parents or our grandparents get older, they kind of feel lonely. They feel like their friends are passing away, they lost touch. So that social isolation piece is a huge part of health literacy, especially digital health literacy. There are studies to link that as well. So when you have low DHL in this group, what makes it the most challenging is for them to access health information. So this causes a digital divide. So what do we mean by digital divide? Digital divide is exactly as it says. There's a division, there's a gap between access and their ability to access health versus people who have versus who don't. If you look at our older adult population, only 32 to 42% of them own smart tablets. This is according to the Pew Research, the surveys that go along. And more so, and if you look at the age group 75 and older, technology use is even more limited. So let's take a minute and think about it. Our 75-year-olds were born 75 years ago when there was literally very hardly any internet. So now think about that population having to do MyChart. You probably all have someone in your family or friends who has this challenge. And this is the age group where they have the least likelihood to communicate with their doctors. So who's going to help them? What are we going to do about it? So in one of the surveys in 2019, it was reported that 95% of those aged 16 to 24, our younger populations, are always pretty much connected to the internet, correct? Versus if you think about the 75 plus or the 55 plus age group, it's only 58%. So that opens another room for what is happening and what do we do about this? Hence, we started to work on this project, which is a community-based participatory project, and we really purposefully did it. We did it with an intention to help address digital divide. So digital divide is a discrepancy between people who have access and resources to get new information and communication versus people who do not. So that digital divide was the main basis for us to think about STEL. And our project started right after COVID, and we got feedback from the older adults in the community that they only wanted help with this. They were very clear, and they told us that they thought this will go away. They thought technology and digital apps and internet will go away. But after COVID, they really wanted this help. So, especially in the low income group who are struggling to have access to care, who don't have internet sometimes, who do not have help to get to access those communities is what we wanted to touch. So we wanted to reach and provide equitable care, and we wanted to bring students into the community. Of course, students are very passionate about helping older adults, and there's a connection right there when we meet. You see in the picture how one of our previous TEL students, that Samira, is like enjoying with me, and then thinking about how we design it. So we wanted to talk to them. We wanted to ask them their feedback. So that is what is a community-based project. We participate, we engage everyone from the beginning. And our goal was to advance health equity through education, and we wanted to make sure it was evidence-based. So the need for STEL is further built on 4 additional goals. First, of course, to improve digital health literacy, to bring skills in a very clear intervention. That was the STEL intervention. So we could engage them and we could teach them right where they are. Not having to have them come to a different place or site when transport is an issue, etc. The next thing is, as we all know, the smartphones and the apps and everything is not meant for older adults. The interfaces are very complex for them to navigate. So we wanted to make sure that these designs interfaces are tailor-made for them also to accept, for our older adults to accept and use it without fear. So the designs need to be changed. So that is another, goal for us in the future, of course. Now the need for STEL was basically built on addressing the barriers that we saw in the community. The first thing is physical limitations, vision challenges, hearing challenges, the dexterity and the cognitive load. All of these are the barriers in addition to the skills itself. So the skills, if they don't have the skills and they have all these additional challenges, how can our population of older adults trust us and trust the data security? How will they be able to use it if they feel like we're not helping by changing all of or some of these barriers? And now that brings us to the next question. How will policy in the future in equity and access be more available? Because this is becoming fundamental. It's almost like food and clothing. Digital access in healthcare is fundamental. And I want to stress that if in the lower income groups we do not have people with broadband internet, how can we expect them to access my chart? As nurses, as we lead these interventions, that's the primary question, which should help us drive policies that include preventing security breaches, providing data privacy, and of course, not least, but providing the workforce in the community to take these projects like STEL and use it in a very wide scale, like large scale models. So now I'm going to talk about the phase 1 of our project. where we pretty much went into the community and asked feedback from our older adults, and the students helped us create the handbook. So the STEL handbook, which is found in our website at niu.edu//STEL, you'll see the handbook, and then you'll see this website that has all the resources for older adults. So they would be able to get their anything. Let's say they want to watch a video on diabetes management, or if they want to know how to give themselves an insulin injection, or if they want to like reach out to know about some research in Parkinson's disease. So we have all those websites linked into this links into this website. And what we did was inside the website, we also, towards the end of the STEL phase 1, we created a toolkit which will help train the trainer. For example, if somebody wants to use it in their retirement home or in a different state other than Illinois, they could use the toolkit and the handbook, and we could provide the support to implement it in their place. So talking about the handbook, if you look at the picture on the right, you'll see that the older adults had these large fonts, colorful copies of the handbook. We also gave them in hand, in addition to loading them on the website. We made sure the instructions were simple, had visuals with pointers, and we were also with them, and we made sure they were in small tables, and we could all go around and watch them and help them as they needed. We also gave them each a smart tablet to keep. And when we did this project, we did 3 workshops. And as we did each workshop, we did pre and post surveys. And we did it over a period of 2 weeks. So people, in the group did not feel like they forgot what they were taught before. So we collected data for pre and post for the workshops. And these are some additional pictures. And what we learned from the participants was that they found STEL phase 1 very usable, meaning they felt there was significant improvement in using the internet. They were very comfortable logging into the internet and searching the internet, and also visiting the STEL website. We also learned from them that they found, most of them, at least 80%, felt that the program was meaningful and that they would recommend to others. They also shared that the handbook was useful and it was easy to learn. So we successfully have published 2 articles. Thanks and kudos to our team. You could find both articles and I can send a link if you reach to me. And we are working on the 3rd publication. So now I'm going to turn this and give it to Dr. Srikanth, who will talk about STEL phase 2. Take it away, Dr. Srikanth.
Thanks, Dr. Saravanan. Hello, everyone. Thank you so much for being here. Let's talk about scalability. So in phase 2 of STEL, we basically took that toolkit development. We led more sessions. This time they were faculty-led. So we had 4 PhD-prepared faculty in the health sciences that basically facilitated these sessions. We also wanted to reach a broader geographic area in the Chicagoland area. So that was one goal that we definitely accomplished. And of course, we wouldn't be able to do it without our wonderful students. So we had more students for this phase 2. Dr. Shavanan, could we move to the next slide, please? So this is our phase 2 team. A shout out to everybody for making this a wonderful, successful, and very meaningful project for all of us. We started the phase 2 with the training only because we wanted everyone who was involved to be on the same page, what's going on, how we're going to go about this project. So we had the toolkit that we looked at. And then we also did a little bit of virtual and in-person training as far as using those tablets, because we realized pretty quickly that not all of us are accustomed to the ecosystem of the tablet. So that was one big part of it. We also wanted to talk about strategies to engage older adults who had limited experience. And of course, we also wanted to consider cultural and language strategies, because again, we do recognize that the Chicagoland area is pretty diverse. So we wanted to include that. And of course, the trauma-informed approach, which is a big part of how our students are trained. So we also wanted to kind of be prepared for that and have that included as well. As far as the overview of the plan, so the first thing we did was to map out some of these retirement homes that we thought could be a potential for our project. We reached out to low to moderate income retirement homes. We try to attract or at least try to look for diversity too if we could. And then at the end of it, we did shortlist 3 retirement homes. And we kind of were pretty successful and finished the project on time in April of 2025. As far as marketing and promoting the project, all kudos and shout out goes to the site activity directors, the staff. I think what was really cool to see was their buy-in, their passion when we brought this project to them. So they were all in, and they were like, "Yes, we'll do it. We'll get we'll get you our people to come into the sessions." So we had flyers which they distributed, whether through a common area, through a newsletter of some sort, or even just putting them in resident mailboxes. So again, a huge shout out to staff on the sites. For technology and setup, like I said, we had to kind of get our the tablets ready. So in our case, we use Samsung A7 tablets. So we made sure that they were up and running, loaded with all the links, shortcuts. If a PDF of the handbook was made available on the tablet itself. And I think a big part of it was also making sure that the accessibility features work. So we did a thorough run through of each tablet to make sure it was fully functional. For connectivity, we definitely relied on Wi-Fi, but I think we also kind of had a little bit of a plan B, which said if we cannot connect to a Wi-Fi, we definitely want to make sure we can do some hotspots. And then, of course, we as a team, again, kudos to the team. We kind of had 2 groups going, if you will. There was the main group that was at the site, and then there was the rest of the group that was like a backup because we had to troubleshoot sometimes. It's technology, right? It's great when it works. So that was a cool part of the project where we had folks on phone, texting. We had to Zoom sometimes, but we definitely had a good teamwork going there. As far as evaluation goes, we did pre and post surveys. We definitely wanted to find out what's the confidence level, how comfortable are you with your skills now, and of course the ability to access health information, which is the primary goal here. So it's not just about using a cool piece of tech, it was also can you access and how do you feel about it. We also had focus groups for our facilitators and students. Because we really wanted to find out how they experience this, what are some key takeaways, what could be improved for future applications projects. Results and outcome. We are excited to share that we met our primary goal, which was to serve more older adults. We had 3 retirement homes and we reached about 30 older adults. Our secondary goal of greater than 80% should show some sort of an increased comfort level using tablets. That was also achieved. And of course, our facilitator goals, where we were successfully able to deliver the curriculum and engage with our community. One of the cool unexpected benefits was that every place we went, there was an enthusiasm and a request to have more sessions, to come back, to do ongoing booster sessions. So that was really encouraging to see. And it also speaks to the need for projects like this, the need to, help our older adults kind of get with the digital piece of getting information. We did encounter some challenges, but again, we kind of did a lot of troubleshooting as we went. So for example, we had the lack of Wi-Fi, which was easily mitigated through our hotspots, of course. We also realized pretty quickly that our participants had very tech readiness. So that was, again, something we worked on as far as getting down to the one-on-ones, basically meeting the participant where they were. So if it so with the one-on-ones, we were able to customize that experience and help them and scaffold their learning as well. We also noticed some health and mobility challenges, which again, we tried a solution with increased font, magnifiers, working one-on-one. So those were some things that definitely helped us be successful with our participants. So some of the key takeaways for us on this would be the feasibility, because STEL definitely improved the digital health literacy and health self-efficacy among our participants. We also had wonderful feedback from our focus groups with the facilitators and the students. Little things like, maybe we need to have more copies of certain of the handouts. Maybe we need to do a little more tiered instruction. So all those, the troubleshooting that we did along the way has now helped us implement those strategies for the future projects. Definitely a huge impact as far as nurse-led. We had the community engaged approach going on. It was really nice to see people excited when we came back. So that was a really cool part of it as well. We also looked at more broader benefits like fostering trust, inclusion, and just having a sustainable program for our populations. Team collaboration. I cannot say enough about how wonderful this team was. We worked really well together between the students, the facilitators. I think it was absolutely incredible to just literally know that we're there for each other. That was a big one. And of course, one-on-one instruction. That was by far one of the most prominent themes throughout this project, where participants appreciated the one-on-one that we gave them, especially in helping them navigate through the tablet. And of course, one feedback that we got, which again was pretty, I think it came through in many sessions, was maybe use like the television sets that are in some of these facilities. So we have a larger screen where we can kind of connect one of the tablets so it's more open, more visual. So that might be like a focal point where people can look and maybe we can go through some steps on it. So that was definitely some fantastic feedback as well. And then, of course, another key takeaway was more sessions. Some even suggested, can you do virtual? Can you call? Can we have Zoom sessions? So all of these are being definitely considered. So sustaining success. So again, we're going to continue using our toolkit. We're going to have ongoing partnerships, refresher sessions for sure. We're going to do some with the NIU interns, allied health faculty as well. The STEL handbook. So that's it's undergoing revision. So we're going to add instructions on other technologies too, not just the Samsung. So we can include more ecosystems as far as tech goes, and additional languages. That's important too. And then with upcoming initiatives, we have a train the trainer model, which I think Dr. Sharvanan also alluded to, where we kind of want to make sure that staff can also help with the STEL project. And definitely a wonderful centralized portal on the STEL website where folks can access it and definitely use it. All right, with that, I will hand it back to Dr. Sharvanan. Thank you everyone for your time.
Thank you, Dr. Shrikant, for sharing, this important phase 2. As we look at how projects can be scaled, we all agree that, a great team is very important. And I cannot thank enough Dr. Sterner, who's our health science librarian, who really helped us with developing the handbook to make edits and check it for us, and even for the toolkit. A huge shout out to Dr. Yujun Liu. I don't know if she's here, but also to Dr. Pam Gampetro, Dr. Ann Lucas, who are the STEL facilitators, and of course our wonderful students who are right here, Hannah Kaplan and Belanley. We also have Masuma, I know here. So what we want to do now is, before we ask any questions, I would like some of our STEL facilitators and our students to share their insights. I would like to now welcome Hannah, because you're here. Do you want to share? I want to introduce Hannah. Hannah is a student nurse from Northern Illinois University, and she has worked with us in all the 3 retirement homes for this phase. And I think from her viewpoint, we can all learn a lot. Go ahead, Hannah.
Hi. So, working with older adults through the STEL team, it showed me how meaningful it is to really bridge the gap between health information and accessibility, as a lot of the participants were very eager to learn, but faced barriers with technology that limited their access. Being a part of this showed me the importance of meeting older adults where they're at and designing training that respects different levels of technology literacy and just building trust and confidence step by step. I think my biggest takeaway from this was how intertwined technology literacy and health management have become, and supporting older adults in both of these areas can make a big difference in their independence and how they manage their health.
Thank you, Hannah. Belanley, do you want to share something now?
The STEL program is a very wonderful one. I had a good time communicating with the older adults. One of the things that is like they want to learn, they're eager to learn. Most of them are eager to learn, but some of them have some physical barriers like cognitive abilities, and mobility, vision, hearing, things like that limits them in one way or the other. One takeaway from the barriers they talk about is the fact that because we have a lot of people in the room. So when someone is speaking beside them, it confuses them like, oh, I just want to be alone with the person teaching me this. I don't want to have any other interactions with my hearing from every other person. So that's one thing that I know that the team is trying to work on going forward. Also, they want to have like a continuous workshop, like a session with them. So in case they have one issue or the other about the Samsung tablet that we gave them, they want to be able to have someone on ground to put them through it. It's a wonderful one, and I believe that it's going to do a lot with the digital health literacy in the older adults. Thank you.
Yeah, those are great insights, Belanley. Masuma, do you want to share?
Sure. Sure. I think one of my biggest takeaways was even though our intention was to help them with health related technology use, a lot of these older adults had technology, but it would just be sitting there because they don't really know how to use it. So if they got a call from family members or if they were receiving text from family, they wouldn't be able to reply. So I think though we were helping them with their health related technology use, we also help them in a lot of other ways. So now they're able to call their grandchildren from their own devices because we've shown them how to do it on our tablets. And for the accessibility, I know one of the things that we did that seemed to help a lot is for individuals who had hearing aids, we were able to connect their hearing aids through Bluetooth to the tablets, and we were also able to go in through settings to increase the magnification and text size and everything, and it kind of showed them that the devices that they have at home that they're currently unable to use, if they make these same modifications, they're also able to do all of these things on their own devices.
Yeah, thank you for carrying us through the importance of building trust so they are open to be getting the help from us. Dr. Lucas, do you have anything to share?
Yes, hi everyone. I'm very grateful to be part of this project. Kudos to everyone in this team. So some of the lessons that I've learned as individually is that recognizing our older adults, that what they benefit most from that individualized kind of care with that step-by-step instruction, starting with those very basics that we did with empowering them on the tablet and actually proceeding gradually to knowing them and to help them to navigate the whole process along with accessing those critical resources that Dr. Shrikant had mentioned, I think was some of the things that made us delve deeper to help our folks. And so it also fostered other qualities while working with them, like with empathy, patience, and also thinking of us in the future. We're going to be there one day in that same space, trying to learn how are we going to navigate, right? In 2020, 15, 20 years from now. And with the active listening skills, some participants had started with little or no digital experience at all, right? And so they needed that hands-on exposure to become more confident. And so with all the impact that's happening right now with this study, I do see some tangible progress, and noting how our participants with the initial hesitation has come far more better in terms of learning and with our days going forward. and navigating all these device settings and all that for us. And we're knowing that we're with them, I think it really goes a long way. So it does reinforce reinforce the importance of community-based participatory research and adds more value to what we're doing. And getting direct feedback from our older adults is the most important thing also, among others. So thank you for this opportunity.
Thank you. So now we're about 20 minutes away, and we welcome any questions that the audience has.
Yes, thank you for that presentation. I'll just reiterate, if you guys have any questions, you can put them in the Q&A box and I can read those out to the speakers. We'll give you guys a couple minutes to get those in. And while we wait, I can put a couple links into the chat as well, to the toolkit and to the website, so folks can go visit those as well. Oh, we do have one question here. As young persons who are very computer literate, what surprised you the most?
I can share this. It humbled me. I am not as young, I would admit. Even though the very first time when we did this project, we had many older adults in the places we went to have their flip phone. They just would flip it. And that was a very humbling, moment. And when I went and looked into the literature to see, there were a lot of digital health interventions, but nobody talked about how to teach people to not to use a flip phone when we're all so advanced in using smartphones and touching. That was one of the most humbling experience for me. Again, I'm not a younger person, but I will have others also chime in. Anybody wants to share?
Yes, of course, humbling experience. We get to know all this, although we're in our, late 40s, 50s, and then reflecting on that, oh my God, I'm not that young, but I still get to feel the profound experience of this kind of a weird feeling, Yeah.
For me, I'm surprised that, well, I know we talked about the generations moving from, different generations to another, and we talked about how some people don't know how to use internet technology, but it's like a real deal when I saw some older adults that they couldn't even put on their phone. They needed help for everything, and it also like tell me that we will all get there one day, and probably there's going to be a lot of changes to technology by then, so we need to keep improving ourselves.
I also think it was a bit surprising how different each brand of technology is. Like I use Apple, so when I was teaching them how to use a Samsung tablet, I also had to like sit down and learn how to use it. So I just thought it must be very difficult for them since they're transitioning from like their flip phone. Or one of our participants actually like contributed to servicing like the first computers that came out, but he had no idea how to use like our current technology.
Yeah, we have us. Go ahead, Hannah. Go ahead.
I was just gonna say, while a lot of them did struggle with using it, there was a few that did know how to use their technology to some extent. But once we showed them different things on their tablets or phones, they really ran with it and they were able to do a lot more.
Thank you. We have 3 more questions. So I'm going to read out one at a time, and if any one of you want to answer this. So the first question is, moving forward with this project, how do you envision implementation of DHL within the nursing daily work routine? Any
I can share
takers?
a little bit. I can share a little bit. I mean, it's definitely something that would depend on the unit. Is it inpatient? Is it outpatient? Maybe some, it also depends on time factors and resources as well. But I think that's actually a great spot for it too, especially like when like patients are leaving at the end of the visit. I know we talk about the teach back method. So maybe there could be like little sessions that are offered by ambulatory centers, maybe about do you know how to access, say for example, how to make an appointment. And that actually came up in one of my sessions. I think as soon as someone realized that I'm from Loyola, they kind of thought that I was a part of the hospital system. So it went into this whole, how do I make an appointment with so and so? Again, perfect learning opportunity. We pulled it up. We looked up the Loyola site. We found the numbers. So things like that, I think that's a huge potential. So thank you for whoever asked the question. It's a question idea, which actually has potential. So we could look at it. And again, like I said, we are open to coming into places and maybe training, showing people how to use the STELL toolkit. If you know of anyone who is interested, just let us know. We can definitely look at working with nurses who are in contact with patients. Thank you.
Thank you for that insight, Dr. Srikanth. Anybody wants to add anything, or we could go to the next question? I do think that we need to look at low-income groups for this question and have a tell, a champion there, if possible. Of course, during discharge, if we can help them navigate, even if it's a remote session. I think the need is more in, vulnerable low-income areas to identify those locations and give access more to. So the next question is, could you talk a little bit more about the librarian's role in the intervention? I'm not sure if Elizabeth Sterner is here, but I do want to share that from the beginning of this project, Elizabeth Sterner, our health science librarian at NIU, was integral in not only bringing the resources for our STEL website that was, user-friendly for older adults, but she would check the handbooks and every part of the work we involved her. So she was able to proofread our manuscripts to give the attention that the handbook that the students developed was right and appropriate, and the toolkit as well. So thank you, Elizabeth Sterner. I think there is more potential to involve public, more community libraries in this project. And I did reach out to our local library in DeKalb as well, if they can use those resources. I think we might need to do like a library session for the community to show what is available. So there are a few more questions. So I'm gonna see if, okay. I appreciate the comment about participants wanting people on site to also be trained to help after the sessions. Was this something that was included in the initial workshops? I'll take this. We only had 3 workshops, and all the older adults and the community staff wanted more sessions, which we were not able to do. However, we had additional sessions for a different project that we worked on that, Bolani was also part of, that they really embraced it. And I cannot tell how grateful I am for our students. I just cannot say that enough. Thank you, all of you, Hannah and Masuma and Bolani. So there's one other question. And of course, some of the students are not able to make it today, like Alyssa and Ria Johnson. A huge shout out to them too. So there's another question. I appreciated the Bluetooth connection. Masuma, that's for you. I would not have thought of that. If you followed up with a cohort of learners, did they remember or practice what they had learned from one session to the next? That's a great question. Masuma, do you want to answer that?
Sure. So a lot of them actually did remember. I think it depended a lot on their initial comfort with being able to use a tablet. So for the individual whose Bluetooth we connected, he was actually fairly comfortable with using his phone and his iPad already. So one other thing that we did was, like, if they had an iPad, instead of teaching them on our Samsung tablet, we did try to also help them kind of show the equivalent of, like, if you would do this on your Samsung tablet, you would do this on your iPad. So he was able to then independently connect his iPad to Bluetooth, since he was not one of our raffle winners, so he didn't get a Samsung tablet. So that way he was still able to, like, continue to use everything once we were gone. And when it comes to, like, making the text bigger as another accessibility aid, they weren't really able to do that on their own, only because they couldn't see the font when it was small. But then once you make it bigger for them, then they're able to navigate just as, like, we would on a normal screen. It's just that when the font is small, they're just unable to see it.
Yeah, thank you, Masuma. I think I do want to add how important the work that we do with the students, connecting the intergenerations, bringing across age groups, we faculty in the middle, having our students, and then having our older adults involved in the community has not only been challenging, I should say that, we would have still dolphin team, we would have still surfing teams, we would be like constantly texting and like, where are you? Amidst all that happened since we started the project, it was an eye opener to learn. For me, it was a learning opportunity from Masuma and Hannah and Ria and Belenly and everybody that I really cherish. And it's very few times these projects happen. So with that, there's one more question. In your nursing school programs, will you build in DHL awareness for older adults in their training so they take the idea to their work environments when they graduate? That's a really great question.
Anita, can I take this one?
Yes.
So as you can tell, we're like different schools in here. So for me, as being a Loyola faculty, I teach community health nursing. So this project falls right in there. It aligns really well with what we do. So for now, the plan is to kind of do it as okay, here's TEL, this is what it is, the importance of it. But I'm also looking at some ways to like find some funding, maybe get some of those tablets going. But yes, to answer your question very pointedly, yes, there is plans. We are doing it. I'm actually teaching this course right now. We're in week 9. So I think in week 11 and 12, we're going to be focusing on this particular topic right in the classroom and just having some discussions. We're going to pull up the STEL website and definitely implement it. Thank you.
Yeah, thank you for that. I do teach an advanced leadership course, and I gave this as one of my lectures as to how to do a scalable project and how to be a leader when challenges come up and how to successfully run digital programs, especially as we move on into the AI world. So now I think it's time to not only think about DHL, but AI literacy as well. Because I think without innovation, without including our vulnerable populations in any innovation is not innovation. If we leave people behind, I mean, if we go to the moon, I guess that's different. But for basic needs, if we cannot include everyone, our innovation is not innovation. And I think that's the power of these community-based participatory projects where we go in and we're in their sandbox, we are pretty much dwelling and seeing what they do. I mean, people could not charge their tablets right away. We're talking about no access to broadband internet. That was the most eye-opening for me. Like if we're going to be in this Ivy Tower and talk about AI and literacy and like my chart and curing every disease that's available, but we have populations who just don't have the basic needs to go into my chart. That's where nursing loses. So what are our students going to do about this? Our student healthcare champions.
I think now, especially in like the current healthcare setting, since a lot of the portals and everything are digital, I do think I've noticed like an increase in like when you're registering at the front or when you're checking in for your appointment, they'll ask you like, "Are you set up for your portal? Do you need help downloading the app and things like that?" So I definitely think that's something that once we're in the field, we will also be promoting a lot more is if you don't have the app, we can help you download it, or like we can show you how to use the QR code on your after visit summary and things like that.
Yeah, a lot of our patients are older adults, and we're taught to start, discharge education on admission. So I think adding, how to like do follow-up appointments, how to set that up, how to look your results is important to learn now.
We do have about 9 minutes. Oh, there's one more.
I was gonna say there's one more just popped in if you want to take that one.
Yeah, thank you. Do you think the digital challenges such as understanding technology and accessing broadband is generational? To rephrase, when the younger baby boomers age, will they have less technology challenges? That's another great question.
I can answer that as someone who's not in that baby boomer age group, but I'm also not like young. So I think to me, like, I think someone here said it, like, today I'm tech savvy, I can navigate, I can click and stuff. But as that technology changes, the bigger question is, would I be able to keep up? So I think that's where I can see maybe not like a major lag, but I personally foresee a lag as far as my skills and keeping up with what's current, like say when I'm 70. For sure, I do see it. And again, I might just be speaking like as an N of one, but I'm sure if there were other folks my age in the room, they might, agree. And also I think it depends on where you are. Like as far as like if you work in the tech field, maybe you might be a little savvier than me. So I think I see a lag, and I'm hoping that there'll be more stills that'll help folks like me. What do you guys think?
Like I mentioned earlier, I think there's going to be a lag. So it's an individual thing. So if you decide you want to keep up with what is happening in technology, then you will be fine. But if not, then there will be a great lag. The technology we have right now is different from what we have 10 years ago.
I agree. I think, oh, sorry.
Oh, I was just gonna say I agree too. I think there will still be some technology challenges because technology is changing a lot even now, and they redo these health platforms, and sometimes it is hard to keep up with.
Yeah, I agree with all of you and what was said. Today, it's a digital divide, and I think we might have a different divide. For example, if emerging AI, generative AI, move on to the a cognitive divide, I would say. Let's say if I think it shows in a screen, I cannot think one thing at a time. Do you guys see the point? If we have quantum and we have like these plasma screens or whatever in front of me, and as I get older, instead of my fingers, maybe I have to use my thoughts. So if I think I want a medication, that medication will come. Let's say it's 8 in the morning and I want my aspirin. Okay, I'm just putting it there. And if I think something else, that might come. So then I'm going to be challenged. So we don't know what the future is going to hold. I don't think it's going to be digital divide in like the next 20 years. It might be an AI divide or a different type of challenge that we all will envision and we might see, and we will learn and grow through that. But that was an excellent question to really think about. Um, and thank you for all your questions and for this opportunity. And thank you, NNLM. And so thank you to the STEL team.
Actually, a big shout out to Dr. Saravanan for her leadership and guidance on this. I think it speaks to your leadership because, just coming together as a team, like you said, different generations, multiple sites. This was no easy task, and you rocked it out. And thank you. Thank you for everything. Thanks, team.
We are a team. Couldn't do without us.
I was going to say, I'm going to echo that as well. You guys have, over the past couple of years, built a wonderful program, really good partnerships across, multiple organizations, and it's been a delight and a pleasure to see this project come to fruition. So we really do appreciate it.
Thank you.
And then we have a couple minutes left, so no more questions. So I'm going to put into the chat, there is a link, and this will be for the feedback survey as well as where you can claim your CE for the session. And we did record the session, so we will follow up with an email with the recording and a link to this feedback survey as well.
Thank you. Thank you. Bye-bye.